Welcome to this episode of Eye on IMS. I'm Pat Hindle. I'm here with my co-host Gary LaRude. Today, we're going to take a look at the safety precautions and procedures that will be used in the Georgia World Congress Center in Atlanta to keep all the attendees and exhibitors safe at IMS 2021. We are here with Paul Garucci, Georgia World Congress Center Chief of Police, and Carl Sheffries, IMS Event Director. Welcome, Paul and Carl.
Thanks, Pat.
Good afternoon.
So let's start off today. Paul, where are we with events in your facility? Are you running them now?
Well, actually, we are. We had a very exciting event that we just wrapped up last weekend. It was sport. So thousands of sports fans and sports enthusiasts were in the building, and we had a great time, and we consider it very successful.
Well, we understand the center there was the first facility in the U.S. to achieve the Global Biorisk Advisory Council's STAR accreditation for COVID-19 cleaning, which is very impressive. What is the cleaning process that earned the accreditation?
Well, like you say, it is quite extensive and very, very robust. So at a high level, what it means is we do extensive cleaning. So throughout the facility, especially with a special focus on where the event is actually going to happen. We do continuous cleaning with approved cleaners that have been approved by the EPA to fight the COVID virus. We do that throughout our building routinely anyway, especially on major touch points such as doors, door frames, escalators, elevators. That's a constant process. But we also have some of the electrostatic devices that actually fume the building. We have several of those. So that's part of our robust cleaning protocol.
So besides cleaning, what kind of facility-wide changes have you made that help attendees and exhibitors feel safe?
Well, we can actually start off with what we do with our employees. So we basically have controlled access to our entire building. So you can only come in our building depending on the event, but through a controlled access point. So for our employees, all of our employees go through a screening process where we go through our employee entrance, and there's a temperature screening there. And of course, there's also the messaging. And we have been going through this pandemic for quite a while now. So I think the biggest key to the success here is the individual first recognizing their responsibility to society and themselves. If they don't feel well, they just stay home. And then if they do come to work, there is that screening process. We have a very robust HR department that is constantly putting out messaging as far as if you're not feeling well, don't come to work. And then if you do, there's a tracing element to that. Of course, it's as confidential as it can be, but we are very alert to that, and we have a good system in place. We have developed a document. It's called an infectious control plan. It's a very comprehensive, and it starts out with a questionnaire. How are you going to manage this? Are you going to do temperature checks? Are you going to require your patrons to wear masks? And it kind of follows the CDC guidelines and then our protocol as well. So once that document is filled out, I look at it and ensure that it is actually filled out in its entirety, and that it addresses all the key points and recommendations of the CDC as far as guidance. Like, how are you going to ensure that people are socially distancing? How are we going to ensure that people are actually wearing a mask? What's the enforcement piece? Who's going to do it? If someone fails to comply, how are we going to manage that? If someone actually is not feeling well, do we have a medical tent? Do we have medical personnel that can manage that quickly? And what's the follow-up to that? There's also another document that we have in place, and it's called our security plan or event action plan. And those two documents have to mesh. So in other words, whatever the infection control plan that we have put in place, it also has to mesh with that security plan, because those are actually an enforcement piece to ensure that everybody is as compliant as can be. And that also includes the cleaning piece of it in that infectious control plan. Who's going to do it? What are your key touch points? Where are your key areas where people are going to congregate? All that's identified and put part of this plan.
Beyond the facility, what are the restrictions imposed by the state of Georgia and the city of Atlanta? And are these policies at the airport the same, since most attendees will be flying in?
Yeah, the executive order, in a high level brief of it, it would be that, social gatherings are certainly not encouraged, but if you do have gatherings, the key components of that is social distancing, wear a mask, and it's transitory. And certainly our groups are transitory, they go from one place to another. Another key piece of that is, does the actual facility or room that you are holding the event isn't adequate to support the social distancing? So when we look at your plan and we determine what meeting room or what event hall you're going to be in, we will look at that through a CAD drawing as well and determine if the amount of people will fit in that location or that space and be able to remain socially distanced. So we'll also use that to set up the chairs, the tables, any component or piece that involves people. We will ensure that plan looks at that, recognizes that, and builds the appropriate plan to support the social distancing.
So who have you consulted with to frame the Georgia World Congress Center's health and safety response to COVID-19?
Yeah, we are very fortunate within our public safety department to have our own emergency manager. Very, very keen and actually an expert in this. In fact, he worked for GEMA for a decade. And I have 2 employees here that actually have worked with GEMA for a couple of decades. So he basically has almost a daily meeting with all of our partners that are associated and actually work through our COVID crisis, which includes the Georgia Department of Health, AFCEMA, which is Fulton County Emergency Management, and the federal FEMA. So he's plugged into that, and I get a daily report from him. And then we continuously put that into our plans and keep that into consideration as we're approving and vetting the plans that are submitted. So I feel very, very confident in his abilities to keep us informed of the current status, real time. And of course, the governor's office too hosts that as a very robust web page that shows all the statistics. So not only do we have that, but we have our personnel right here in this building that vets that on a daily basis for us.
Carl, switching to you, what procedures will IMS implement to protect everyone's health?
Yeah, so thanks, Gary. We started by creating a socially distanced floor plan, which you can find on the website, that allows visitors to the exhibition to keep the requisite distance between each other. The aisles are wider in key areas. There'll be directional signage everywhere, as well as health and safety reminder signage. We'll have multiple small networking areas instead of one large area to accommodate smaller groups or cohorts. And those areas will be set up to encourage interaction while maintaining safety. For the conference, there'll be reduced capacity. I guess that'll depend on what the requirements are as we get closer to June. But there'll be separation between seats. And the rooms, of course, will be thoroughly cleaned between sessions. I should note that the exhibition will be deep cleaned as well each night. Surfaces in all of the areas will be wiped down regularly. There'll be many hand sanitizing stations, as well as signage to remind people to keep their distance between themselves and others. Registration and information desk areas will have barrier guards, and we'll keep those as touch-free as possible. And of course, masks will be required in all areas of the convention center.
So what are some of the other additional considerations that you're taking into place?
So the whole, situation remains fluid, right? The hope and expectation is that the situation improves significantly between now and then. Certainly looks that way. And that protocols will adjust accordingly. However, we're considering additional procedures, including temperature checks, one-way aisles, one-way entrances and exits. We'll have medical staff on site at all times. There will be a paramedic on site. And we'll limit the attendance into the exhibition hall if needed.
So we've talked about the requirements for the overall facility, and you've talked some about the IMS steps that are being taken. For exhibitors, do they have additional options on a company-by-company basis that they can add to their booths?
Yeah, I was just reviewing some documents from Freeman, our decorator, and they've come up with a number of different options. They include deep cleaning of booths at night, a number of different types of barriers, whether they be counter barriers, standing barriers, some decorative barriers to keep some distance. And you can purchase sanitation products and health and safety signage from them as well. And that list of items keeps expanding.
So Carl, can you walk us through what the exhibitors and attendees can expect when they register as far as safety precautions?
Yeah, so as I mentioned, registration will be mostly touchless, but when you get there to pick up your badge, you will be asked to fill out a screening questionnaire, and then you will receive a kind of a PPE goodie bag, if you will, that will have some hand sanitizer, a mask, and some other items for your safety.
So what do you want the IMS attendees and exhibitors to know about the event's health and safety policies?
Well, I'd like everybody to know, we're a close-knit community, our RF and microwave community, and we haven't been together for a long time. In June, it'll be by June, it'll be a very long time. And I do want people to know that we will provide a safe environment for all the people that are able to come to Atlanta. Won't be quite the same as in past years, I think that's for certain. But we're all pretty used to wearing masks, and we're all used to, distancing and all the other things that go along with keeping ourselves and keeping others safe. So, I think, again, our mission is to provide a safe environment. We will do that. The chief has pointed out a lot of the things that the convention center is doing. Personally, I'm really looking forward to IMS in Atlanta, and I hope to see as many of you there as possible. In the meantime, stay safe.
So we hope these measures, combined with many of us getting vaccinated this spring, will yield a safe IMS. We missed gathering in LA last summer and are hopeful we'll see each other in person the week of June 6th in Atlanta. Thanks to you for watching, and we hope you'll join us for the next episode of Eye on IMS.